Welcome everybody to day 2 of the annual Brain and Mind Centre Symposium. I'd like to start by acknowledging the traditional owners of the lands on which we meet, and I'm coming to you today from the lands of the Gadigal people of the Eora Nation. I'd like to pay my respects to their elders past, present and future. We in mental health in particular owe great gratitude to the traditional owners. They brought us the concept of social and emotional well-being, and that's one that lies at the heart of much of our work. Just recently through the Brain and Mind Symposium, as remarked on by Mark Scott yesterday, we have launched our mental wealth initiative, which is really Western modern words for something Aboriginal peoples have described for a very long time, the collective social and emotional well-being of the nation in which we live. It was great to have the introductory remarks yesterday of the Vice-Chancellor commenting on the importance of multidisciplinarity, the importance of our work and the future role of this university in engaging actively with the society in which we live on the big issues, many of which are related to the cognitive and emotional resources of our nation and how we particularly assist those during development, the child and youth years, and as we age. This afternoon's program is, I hope, as engaging as yesterday's. We're very lucky at the start to have a really long and really interesting commentary by previous Prime Minister and first female Prime Minister, of course, of Australia, Julia Gillard, followed by a series of plenary presentations by Hickie and Jacqueline Troy on dementia and the role of Indigenous people. And then some really great postdoc and early career researcher presentations in the middle of the afternoon. Finally, we'll have a discussion about translation in practice, in real life, taking the area of dementia in particular, how we get from the bedside to improved care, to better policy, and back again. That ain't a one-way street. Translation is not a one-way street. It's an iterative cycle of continuous improvement in the lives of people who are affected by the conditions in which we are most interested. So we're going to kick off this afternoon with a recorded presentation by Australia's first female Prime Minister, Julia Gillard. For those who follow her on Twitter, and I'm one of the 800,000 people who do, you'll see that she's just arrived in Glasgow, and part of her new role as chairman of the Wellcome Trust, engaging with perhaps one of the world's biggest health issues at the moment, that of global action on climate change. Now, for those who may not know, Julia has also been the chair of Beyond Blue, and I'm very glad to say she set up the National Mental Health Commission. I was very glad to be appointed to that commission in 2012 myself, which she set up to enhance accountability for mental health in this nation. Since her time as Prime Minister, she's gone on to many other important issues in the world, including being the chair of the Global Partnership of Education, the chair of the Global Institute for Women's Leadership at King's College. She's recently written her second book, Women in Leadership, Real Lives, Real Lessons. And most recently, and really important to us, she's become the chair of Wellcome, the global charitable foundation focusing on solving some of the world's really big urgent health challenges. And for those who don't know, the Wellcome Foundation has really taken on mental health in a big way, £200 million investment with a very strong focus, particularly on adolescent depression, on prevention and early intervention, areas that are really relevant to our work. And you'll hear later in the afternoon from one of our postdocs, Jacob Cruz, who's been fortunately funded by Wellcome Foundation in one of those areas. I'd really encourage you to actually listen carefully to what Ms. Gillard has to say. The introduction that she gives and the detail that she gives about where we are at with regards to health and medical research, particularly the focus on those issues of brain and mind, I think is instructive for all of us. I'm extremely grateful to her for having taken the time to produce such a long and incisive discussion of those particular issues. I would like to take the opportunity myself as co-director of the Brain and Mind Centre just to thank everybody for their contributions this year. It has been a tough and challenging time for all of us over the last 18 months. And there is a long way to go until we actually are able to resume many aspects of our normal life from the past, but perhaps more importantly, how we reconstruct and do better in the future in an inclusive way, in a way that actually promotes the social and emotional well-being of the nation in which we live. I'd really like to take the opportunity to thank particularly the staff from our ASU, from our Administrative Services Unit, and those who put together the symposium today, and those who worked throughout the year in really challenging circumstances. I had the opportunity, for those who want to see it on Twitter last night, to meet with the directors of the other MDIs and Duncan Iverson, our Deputy Vice-Chancellor of Research. And there's a lot of discussion about how tough it's been for early and mid-career researchers in particular. those that also have tried to, would normally be doing experimental studies within their labs and within the facilities, those who would normally be running clinical trials, and difficulties that have been challenges that have been faced. As Matthew Keenan and I have tried to make clear on many occasions, we are deeply committed through the MDI strategy to supporting career development for early and mid-career researchers through philanthropy, through direct support, through inclusion in larger team grants, so that people can have productive careers in these areas. Most of the complex issues that we face really require collaborative teams working over a longer period, working in partnership with those affected, a point made very strongly by Ms. Gillard in the upcoming video recording of her talk, but also being engaged with the society in which we live. I think we are very lucky in the Brain and Mind Centre that we have had the people that we've had be committed to that. We've had the support of the university, and I'd like to take the opportunity of thanking Duncan Iverson in particular, who's been the Deputy Vice-Chancellor throughout this particular period. And we now look forward really to working very productively with our new Vice-Chancellor, Mark Scott. I think as he made pretty clear yesterday, he's pretty convinced about the future of MDIs, and our task is to make the most of that opportunity here at the University of Sydney. So at this stage, we'll go over to the pre-recorded introductory presentation by Ms. Gillard.